Hi, my name is Shawn Ewens, and I am the Executive Director of the Healthy Start Coalition of Sarasota County. Our mission is to improve the health and well-being of pregnant moms, infants, and young children. With the opioid crisis going on in our community today, many individuals don't think that marijuana is a big deal, but it is. Using marijuana while pregnant is not safe for you or your baby. It increases the risk of falling and affects judgment. About 1 in 25 women in the U.S. reports using marijuana while pregnant. Babies that are exposed to marijuana during pregnancy may experience the following problems. They might be born too early, have low birth weight, show withdrawal symptoms such as crying a lot, trouble sleeping, and trembling. Also, poor growth and development, and problems with attention and memory. The following video with Dr. Washington Hill and Danielle explains the risks associated with marijuana use during pregnancy. Thank you, Danielle. You are a brave girl to share your story. We can't wait to see your baby getting a healthy start in life.
This morning we're going to talk about the use of marijuana during pregnancy and lactation. What are the effects of marijuana on the fetus? And what are the effects on the neonate if the patient breastfeeds? We're pleased today to introduce you to a young lady who I first saw when she was pregnant about 15 weeks or so. I'm going to let her tell you her story. But what impressed me about her was, one, that she admitted that her drug screen was indeed positive for marijuana, and two, she wanted to know what were the effects of continuing to smoke marijuana on her pregnancy and how could she stop. Hi Danielle, how you doing?
I'm good. How are you?
I'm fine. How's the pregnancy going?
Pretty good. No problems.
No problems or complaints?
Nope, not yet.
Okay.
Or hopefully not ever.
Well, hopefully never. One little problem came up on your drug screen. As you know, we do a urine drug screen and you agreed to have it done. And it came back showing that you have been using marijuana. Is that the case?
It is true. Yes.
And how long have you been using marijuana?
A few years now.
And primarily, why are you using it?
I've always found that it helped with my anxiety, maybe slight depression, mood swings, stuff like that.
Okay. Now, you're about 15 weeks pregnant. Do you have any questions about your smoking marijuana during pregnancy?
I mean, I know it's not the best thing for me or for the baby. It does kind of make me nervous, but for some reason, I just keep turning to that to help me with my problems. I have been kind of sick lately, struggling with this morning sickness thing, and I feel like that is one thing that has helped maybe calm it down a little bit. But I do have some concerns that I would like to discuss.
Okay. What specific questions do you have before I tell you some more information?
I just want to know how harmful it actually is to the baby, as far as smoking and how much consumption of the marijuana.
Those are good questions. And let me try and share with you what we know about marijuana and smoking. One of the problems when we look at information is that the patient, you, are smoking and marijuana. Smoking alone, we know, is not good during pregnancy, and I know you've heard that before. One of the problems with just smoking alone is it appears to cause the baby to be smaller. So for the amount that a woman smokes, for example, if she smokes a lot during pregnancy, now we're just talking about tobacco and cigarettes, that is related to the baby not gaining appropriate weight. Obviously, the less she smokes, the less the effect. So smoking alone is not recommended because of the effect that it has on the growth of the baby. The other important thing to remember is that when we try to get information about marijuana specifically and smoking, the studies are kind of mixed, and it's hard to separate out the effect of marijuana and the effect of smoking because someone is doing both. Do you understand?
Yeah.
If we look at the studies closely, though, when a woman who is pregnant smokes and smokes marijuana, there is an effect on stillbirth. Stillbirth is when the baby is born dead. And you've worked hard for this pregnancy. We don't want that to happen. But studies would show, and I believe those studies are well done, that there is an increased rate of a stillbirth in women who have smoked marijuana during their pregnancy. Another effect on the baby is the size of the baby, as you would expect, because smoking alone causes a decrease in growth. Smoking and marijuana, the two together, would also cause a decrease in the baby's growth. And then thirdly, and I think most importantly, is in the development of the baby, in terms of the development of the baby's brain. As you know, at this time in your pregnancy, you're about 15, 16 weeks pregnant, all of the organs are being formed. The stomach is being formed, the heart, all of the bones, all of them are being formed. And so is the brain. And the more studies that we look at, the more babies that are born as a result of a mother using marijuana, we're beginning to know that neurodevelopment is affected. Neurodevelopment means brain development. It's an easy way to understand it. That as the brain develops, marijuana may affect that brain development. What does this mean in the future? We're not sure, but it could affect the learning that a child has in first or second grade. So for those three reasons, we definitely would recommend that you stop smoking during pregnancy. You mentioned you were also using the marijuana because it helps you control your anxiety and your mood swings. Is that correct?
Yes.
What I would suggest is that you try not to use it for those purposes. And I usually recommend to patients, try to find your happy place or where you feel better without the use of drugs, and in particular marijuana. A nice warm bath, going to the beach. Some people find it in going to church, taking a walk, having your boyfriend rub your back, putting your feet up, and just relaxing after you work. I know that you work. Any of those, whatever you find is helpful to you to relax and to calm down, try and do that. Some of our nurses feel that way after a day in the clinic, and they say, I go home and I just put my feet up in a nice warm bath. And you may find that, I know you have a stressful job, but find a way to help you relax without using marijuana. The other thing that I need to tell you is that we have other drugs that you can use for nausea and vomiting. And many girls are using marijuana for nausea and vomiting. It bothers me a little when they're still using it at 34 weeks pregnant, but certainly at the early part of pregnancy, there's a lot of nausea and vomiting. There's some prescription items we can use if we need to. There's some non-prescription drugs that can be used if there's a need. But we don't know, one, the safety of marijuana during those early weeks of pregnancy, 8 to 10 weeks when nausea and vomiting are very common. And we really don't know if it works. So for those reasons, I would encourage you not to use marijuana for nausea and vomiting.
So I was thinking about maybe breastfeeding. after I have her. What could be the effects of maybe smoking after you have the baby? Is it harmful passing it on to the baby through the breast milk? Things like that.
The easy answer is we don't know. The good news is you're interested in breastfeeding. And here in the clinic and at the hospital where you're going to deliver at Sarasota Memorial, we really are stressing the importance of breastfeeding. In terms of marijuana, we don't know the effects of marijuana on breastfeeding or really on lactation, you producing milk. So we would discourage you after you deliver going back to smoking marijuana. And good luck with breastfeeding.
Okay, thank you. So my boyfriend, he does use marijuana. He smokes. Is there anything I could go talk with him about as far as maybe helping
Him quit?
him quit or stop? And I also have a friend who was hoping to try and get pregnant. She smokes as well. Is there anything that she needs to be doing as far as stopping immediately before she starts thinking about getting pregnant?
Okay. Two good questions. In terms of your boyfriend, we do have an adult health clinic here. If you would like to come and talk to them about why he's smoking or other things that he can do instead of smoking. We also have a behavioral health if he has some issues that he would like to talk to the doctors about, and if he needs medication, we can help him with that. The most important thing about your boyfriend is that you remind him that as it's getting closer to the time for the baby, that there'll be no smoking around the baby. That if he either is tobacco or marijuana, and you know that, I don't want you smoking after the baby comes, and I don't want him smoking around the baby, and I certainly don't want him smoking marijuana around the baby. You send him outside if he wants to smoke. In terms of your girlfriend, and just share with her that if she's smoking and she's thinking about getting pregnant, or she comes here as a GYN patient and is thinking about getting pregnant, that it's most important that she stops smoking. We don't know the effects of marijuana during the formation of the baby and certainly at the time of conception. She's right now in what we call the pre-conception period, before she conceives. And it's best that those patients not use marijuana during pregnancy or before they get pregnant.
Okay.
Does that answer your question?
Yes, thank you.
Do you have any other questions today?
No, I think we've covered everything I was thinking.
Well, you have a visit coming up in another couple of weeks. Jot down any questions that you may have. Good luck with stopping. We'll be doing some drug screens on you throughout your pregnancy. And thanks for making this information available to other patients.
Thank you.